It is this case of measles, the cases of measles on the rise across the country. And as a result, we wanted to check in with the health director for Rowan County. She is online with us now here, Alyssa Harris. Hi, Alyssa. Thanks for joining us this morning. I read from the CDC website that there are over 700 cases now as of Friday across the country. What is your level of concern now of measles in Rowan County?
Right now, our risk in Rowan County is low, but we are still in this place of preparedness. So making sure that we're checking in with our 0 to 5 population, ensuring that vaccines are readily available, and making sure everyone knows, what does measles look like? What does an outbreak look like? We haven't had a measles outbreak in quite some time, so it's important for us to be prepared in case it does come to North Carolina.
And so as you monitor things and the increasing cases compared to previous years, what would trigger a local public health emergency response then?
Right. So if we see more than 3 cases in the state of North Carolina, that's when we're going to start to be concerned for an outbreak. That's what we're seeing across the U.S. right now, and it would mobilize us, especially, well, we're already doing that right now, right? Vaccine efforts, education efforts, connecting with schools, with early child care centers, ensuring that parents have up-to-date information and that individuals in our community know whether or not they have immunity and whether or not they need to get an additional vaccine, and connecting with their provider on that information.
Talk to me about some of the numbers then, as far as kindergarten vaccination rate up through grade school, and what factors into some of the gap compared to the national level.
Right. So in Rowan County, we're about 91% for our kindergarten vaccination rate. Part of that is students who are just coming in now, so we're still assessing what their vaccination status is. Others are those who need to catch up and may be behind in their vaccine course that they need to take. And so for us, we really want to see a 95% of kindergartners vaccinated. That's where we're going to have the most herd immunity, because we do know that there are children who are immunocompromised who cannot get vaccinated. And so what we're looking at, if we start to see one case, measles is an extremely contagious virus. With COVID, we had maybe 1 to 2 people who would get infected from a person who had COVID. Measles, it's more like 12 to 18 individuals who would get measles if they are unvaccinated and don't have that protection. So we know part of it is just catch up, right? We had COVID, we had things shut down. Maybe people weren't accessing medical care as much as they needed to. And maybe other parts of it are just hesitancy. So not knowing whether or not the MMR vaccine is safe, which it is. It is one of our most safe and effective vaccines that we have. It's been in existence since 1971. So just getting information out to parents to help them make that choice.
Are there any specific schools or communities within Rowan County that have particularly low vaccination rates?
Across Rowan County, we'll see more in the rural areas. We might have a lower vaccine status. And again, that could be due to religious beliefs. It could be due to access to healthcare. I mean, I think that is a big piece that people may not realize is, the proximity of a pediatrician or the ability to get transportation to the doctor's office. We're in the city of Salisbury, so the majority of our folks are in the rural areas, about 100,000 of our 150,000 population.
Why are measles one of the most contagious diseases, and what symptoms should parents be looking for in their children?
Right, so measles has been around for a very long time, and we do have an opportunity to actually eradicate it if we are all able to get vaccinated to that 95% or higher. It is a viral infection, and just the way that it's made up, it makes it very, very infectious. We actually don't see many mutations with it because it is already so infectious. What parents might see is a fever, a cough, a rash. So that should highlight you, hey, maybe I need to talk to my provider. There is a algorithm that helps providers understand whether or not they need to test for measles. Not everyone with a rash is going to need to be tested for measles, but especially if you are traveling. We know it's spring break. We know that there are vacations coming up. If you're going to one of those areas where there is an outbreak, just making sure you're checking checking in with your provider now to ensure that your children, especially those 0 to 5, are protected against measles by getting that vaccine.
Is the county offering, say any clinics or programs in response to this outbreak? And what are some of the protocols as well that the health department has in place in case a measles case is identified there in Rowan County?
So right now, we do have the Vaccine for Children's program. So anyone can come and get an MMR for their children. Also at our pediatric providers, we've been in constant communication with them, and we've seen a lot more people decide to get their children vaccinated, which is fantastic. Children aged 12 and above, or 12 months, get their first dose and then their second dose between the ages of 4 and 5. But if a child is traveling internationally or traveling to one of those places, they can get a vaccine between the ages of 6 months and 12 months. As far as what we are doing, each county in North Carolina, we are focused on preparedness, right? We are not seeing cases here yet, but we are having those conversations with schools, with early child care centers, reaching out to our 0 to 5 age population, making sure that they have the information they need to make that choice to get their child vaccinated. And right now, we're really in that preparedness stage: education, 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 and then getting ready to set up if we needed to go in terms of testing and vaccination. Rolling those out. But we are not there yet. We are very much just early stages, being prepared, watching, and hoping for the best here in North Carolina.
And lastly, Alyssa, any other message you want to send to families in Rowan County who might be hesitant about getting the vaccination?
Absolutely. The MMR vaccine is exceptionally safe and effective. It keeps kids safe, and we do not have to see deaths due to measles. That is not something that we have to have here in this country, here in this county. And so I would encourage you, reach out to your local health department, reach out to your provider, have that discussion, talk about your concerns. It's okay to be a little scared, but it's also important that you have an open and honest conversation with your provider, because we know that vaccination is going to prevent the spread of measles, and it's going to, even if a child were to happen to get it, it would drastically reduce the symptoms that a child might get. But the vaccine is incredibly safe, and so we encourage parents to get their kids vaccinated.
Alyssa Harris, Health Director of Rowan County, appreciate this conversation, a very important one at that. We can't let go of sight, that go as those numbers are going up on the national level. Good to hear that Rowan County is preparing for any scenario there might it hit North Carolina. Thank you
Absolutely.
so much.
Thank you.